No one is safe until everyone is safe. That's been the UN's message for months. But African leaders at the General Assembly have slammed the world's wealthiest countries for hoarding vital COVID-19 vaccines. Will their calls for help finally be heard? I'm Andrea Sankey, and today's newsmaker is vaccine inequality. In December 2020, Margaret Keenan, a British grandmother in her 90s, became the first person in the world to receive a COVID-19 vaccine. It was hailed as a great day for science and for humanity, with a life-saving shot developed in record time. But a year later, it's also exposed how unequal our planet really is. In spite of being a global pandemic, 92% of the 6 billion doses administered have gone to rich countries. Scientists have warned the only way out of this pandemic is through vaccinating as much of the world's population as possible. So during a COVID-19 summit at the UN General Assembly, U.S. President Joe Biden called on wealthy countries to follow Washington's example and donate big to beat the virus.
The United States is buying another 500 million doses of Pfizer to donate to low and middle-income countries around the world. This is another 500 million doses that will all be shipped by this time next year. And it brings our total commitment of donated vaccines to over 1.1 billion vaccines to be donated. We should unite around the world on a few principles: that we commit to donating, not selling, donating, not selling doses to low and lower income countries, and that the donations come with no political strings attached.
Now, one country in desperate need of vaccinations is Afghanistan. Since the Taliban took over, international donors have pulled their funding. And according to the WHO, health workers are now being forced to decide whom to save and whom to let die. The head of the World Health Organization visited Kabul, where he met with Taliban officials, as well as doctors and nurses struggling to treat patients. The coronavirus continues to spread unabated in the country, but funding cuts have seen a quarter of COVID hospitals closed, and the WHO chief says millions of vaccines are potentially being wasted.
Over the past 20 years, significant health gains have been made in Afghanistan in reducing maternal and child mortality, moving toward polio eradication, and more. Those gains are now at severe risk, with the country's health system on the brink of collapse. There has been a surge in cases of measles and diarrhea. Almost 50% of children are at risk of malnutrition. The resurgence of polio is a major risk, and 2.1 million doses of COVID-19 vaccine remain unused.
Now, despite billions of vaccines being produced, the number of people still waiting for those vital jabs is a huge concern. While wealthier nations like the U.S. and the UK have protected most of their populations, African nations have barely begun. Less than 4% of the continent has been fully vaccinated. And at this year's General Assembly, many leaders expressed their frustration with the staggering inequality.
These disparities allow for third doses to be given in some cases, while in other cases, as in Africa, the vast majority of the population hasn't even received the first dose.
It is an indictment on humanity that more than 82% of the world's vaccine doses have been acquired by wealthy countries, while less than 1% has gone to low-income countries.
Vaccine apartheid has resulted in significant disparities in terms of vaccine rollout and availability, with many people in developing countries left out.
Vaccine nationalism is self-defeating and contrary to the mantra that no one is safe until everyone is safe.
Let's be mindful of the fact that a variant somewhere is a variant everywhere.
Kenyan President Uhuru Kenyatta was also among those calling for more equitable global access to vaccines. His country has only been able to vaccinate about 3% of its population. Let's get to Nairobi now, where I am joined by Dr. Luca Saraceno. He leads the Red Cross's public health emergency response in sub-Saharan Africa. Luca, thanks so much for being with us. As a health worker on the ground in Kenya, but also having seen the pandemic managed in Europe, give us a clearer picture of how stark the differences are, how unfair it's been, if that is the case.
Well, the reality is that when it comes to fighting the COVID-19 pandemic, now the best tool we have are the vaccines. This is what really it's available now, and what is creating the stark difference in terms of availability and in terms of really of chances to end the pandemic in a rapid or in an acceptable time, or slowing it down at least in Europe, in the Northern American countries, and instead this is still a much far side in most of African countries. If we look at, for example, the percentage, the coverage, or in terms of vaccination coverage of African countries, we have reached about 6.14% of population having received at least one dosage of vaccine, and about 4% having received two.
Right.
This it's a bit higher than some other countries, such as Kenya, which has received, for example, 4.9 for one dosage and 1.7% for two dosages.
Right. I mean, there's a huge disparity, that we know. The numbers are rather striking. The problem is that some European leaders are arguing, that the pandemic hit Europe the hardest, that the per capita death tolls in Europe were the highest in the world, so it makes sense to them, to buy up and store as many vaccines as possible because they suffered the most. Is there some truth to that? Do you accept that argument, being on the ground in Africa where you're seeing hardly anybody get vaccinated?
Well, the point is, certainly at the beginning of the pandemic, what you saw in Europe was that obviously as the virus tended to affect most individuals of older individuals with chronic diseases, and as Europe has a high prevalence of older individuals and individuals with chronic diseases, which it might not be, although there is a growing population of older individuals and a growing incidence of NCDs and chronic diseases also in Africa. Certainly, what we can say at the beginning, there was a hard hit in Europe. But this doesn't mean that at this stage we should hoard, the European countries should hoard the vaccine, or there should be a neglect of African countries or the countries in the global south and developing countries to access the vaccines. Because really the issue here is also the ability of countries to restart and the ability of countries to quickly respond to new waves.
Right.
Because new waves coming up, for example, in some African countries. In the past few months, we have seen a higher incidence or attack rate or doubling, bi-weekly doubling of COVID-19 cases in many African countries. Then without a vaccine, without the availability of a vaccine, which is the primary public health tool to stop the pandemic, we will keep seeing this going on.
Right.
There is another issue. The vaccine is one of the tools we have to fight this pandemic. Another one is, for example, testing capacity, to the ability to identify COVID-19 cases, and therefore being able to do appropriate tracing, being able to follow up and identify all individuals who might have been infected, what is called contact tracing. Now, if we look, for example, in terms of COVID-19 testing, of about 3 billion tests, COVID-19 tests, about 67 million tests are being conducted in Africa. It's a very small percentage, which means also that the capacity to identify cases obviously is more limited. And which also means potentially the the ability of countries to detect and respond to new ways rapidly might be somehow impacted by that. This is another side of the same problem, but certainly most of these issues would be certainly addressed with a better availability of vaccines, a better capacity to deliver vaccines rapidly on the ground. But certainly, if at the beginning there might have been an issue in terms also of the capacity of countries to deliver vaccines at the moment, considering that about 77% of the whole stock of vaccine is being used by African countries, the issue of vaccine availability is critical.
Okay, Luca Saraceno, we're going to have to leave it there. I want to thank you so much for being with us from Nairobi. Greatly appreciated. Okay, let's broaden out the discussion now, and we'll bring in 3 new guests. From Lucerne, Switzerland is Dr. Annelies Wilder-Smith, a professor of emerging infectious diseases at the London School of Hygiene and Tropical Medicine. She's also a consultant to the WHO. From London is Agnes Gitau, a managing partner at GBS Africa, which provides economic and political risk advice. And from the Isle of Wight is Anna Marriott, a health policy manager for Oxfam. She's also the policy lead for the People's Vaccine Alliance. Thanks all so much for being with us. Annelies, you know what, let me start with you, because we did speak about a month ago about the same thing, to be quite honest with you. And you said before that, you know, preventing deaths globally really is the priority. And I want to ask you if it really is at this point, because we know that governments ignore deaths in other countries all the time. That's why we have huge discrepancies in infant mortality rates, for example. If people were dying from malaria in the United States the way they are in Africa, you know, the US government would be throwing the kitchen sink at finding a cure for malaria. So is this basically, now that they're administering booster shots in both Europe and the US and Israel, as we've seen, are we looking at the same dynamics still?
So, you know, the dynamic of this pandemic is so variable and differs from country to country, and therefore also the priorities may differ from country. But clearly, the foremost objective remains to end the acute phase. And to me, that means reducing deaths and protecting hospitals and healthcare systems. And that should be the priority for everyone.
Okay, let me turn to Anna Marriott, because, yeah, it feels like we're hearing all the right sounds, especially from Washington and what Joe Biden said. But it seems the only way to really convince the developed countries to forego perhaps their booster vaccine programs for right now to try and get more first doses to the rest of the world, they will have to be convinced that a new mutation, the risk of a new mutation or a new variant forming, is a greater threat to their populations, because too many people are not getting vaccinated, and by saying if we're not all protected, no one is protected.
Yeah, I mean, I think you're right. We're hearing lots of the right words, but unfortunately, we've been hearing those words since the start of this pandemic. 18 months ago, leaders were lining up saying that if a successful vaccine was identified and developed, that it would be a global public good. And as your program is quite rightly highlighting, we've got the opposite situation. And we really need now to see those world leaders step up. If they keep doing the same thing, we're going to keep having the same vast inequality across the globe. And what we saw at Biden's summit this week was yet another gesture of charity. We need an immediate redistribution of doses, as the head of the World Health Organization has called for. But that is not all we need. Developing countries are not actually asking for charity. They are asking for the rights to produce these vaccines. And that right is being denied to them by just a handful of rich country governments that are refusing to agree a proposal at the World Trade Organization to lift the patents, lift the intellectual property rules on these vaccines so that the technology can be shared, so that the production can be more distributed around the world, and developing countries are no longer reliant on these handouts from rich countries, which will mean that they are always at the back of the queue. That is not morally right, and as you pointed to, that is not in the interests of people in rich countries either, because until we get this virus under control, until everybody is protected, we all remain at risk of those variants, even in those countries that have been fully vaccinated. So it's in the self-interests of rich countries, but that moral argument about protecting lives now and avoiding needless deaths must come first.
And this is where it really gets confusing, and I want to drive home this point, because you're saying this is not about charity. And the way it is actually being presented by Joe Biden, as we saw at the UNGA, is that we're doing a good thing for these poor countries because we're donating these vaccines. They really don't seem to understand that if these countries can't control the pandemic, we all will suffer. And I have to bring this up with you, Anna, because it was boosted in the UK the other day when you're hearing health experts there saying that because of the massive vaccine campaigns, alongside the herd immunity that's developing, the UK, they expect to be out of the pandemic within a year, that we just have to get through this winter, and that the COVID-19 will become nothing more than really a common cold, or at worst, just the regular flu virus. So how do you square that? The UK has been completely relentless on distributing vaccines and now going for boosters, and it's paid off. The way it's being presented at the top levels of the UK health experts is that it's paying off. Being selfish has worked.
Well, I don't think that's true, and I think that's it's a very narrow interpretation of being safe, particularly when there are countries across the globe that have not seen huge infection levels yet. But this virus is running in other parts of the world. So I think we need to be clear here that if 18 months ago, if a year ago, once these vaccines were developed and proven effective, if we had taken a different path and we had said, yes, these vaccines are a global public good, we will make sure that they can be manufactured around the world and are not under the monopoly control of just a few pharmaceutical corporations, then this would never have had to be a choice between vaccinating people in rich countries and vaccinating people in the rest of the world. We could have ensured that we had sufficient supply for everybody, and we weren't in this notion of handouts or charity.
Right.
We would actually have a much more robust system of manufacturing around the world, with everybody being able to be protected.
Okay, Agnes, let me turn to you because, let's develop this idea that, pharmaceutical companies have been able, particularly in the case of Pfizer, Pfizer's actually had massive profits off the back of its vaccine production. Meanwhile, countries in Africa and India had also planned to try and develop vaccines and haven't been able to because there are patent controls. How is this really affecting populations? You specialize in the African continent. I mean, how devastating has it been for them to not even at least be able to produce generic versions of these vaccines?
Thank you, Andrea. Before I even comment on that, I just really want to say how much I agree with Anna's comment of the fact that Africa doesn't really need charity. What we need is to be able to produce this vaccine at home. So wealthy nations are publicly showing that they're donating, these vaccines to the continent, yet behind the scenes, they're blocking any efforts by WTO and other countries to try and have the patent laws lifted. So that really double standard must be called out. I think we need a stronger voice, particularly from WHO and other organizations, to really call out world leaders. Boris Johnson has really been talking the big game, promising global Britain and how that is working towards supporting other developing countries. But I couldn't stress more, we don't want charity. What Africa needs is to be able to purchase the vaccine. Remember, we're at the back of the queue. Pharmaceuticals have priorities to deliver orders by wealthy nations that have ordered beyond what they need. So therefore, as much as even though we wanted to buy the vaccine, we are obviously at the back of the queue. And I want to stress that African nations were very proactive, really worked really hard to prevent the spread of the virus in the beginning. We saw measures that were taken by countries in the region, compared to how Europe and other countries reacted. So look, I do not understand how pharmaceuticals can really make a profit out of a pandemic. It's a shame. But again, I think the onus is on the African leadership. Somebody would argue that the UK and the EU and the US have priority to their citizens, rightly so. But this is an airborne disease. So how do you expect to be safe if a handful of Britons are vaccinated and the rest of the world isn't? And what they're doing, Andrea, is segregating. So the vaccine access is being used as a geopolitical tool to segregate people. You see the red list. Look at the list of the countries on that red list. They're mostly African countries, the developing countries. So look, it's certainly a shame. There is a lack of certainly global leadership, which is required to fight a pandemic, and also that our leaders really are incompetent because their citizens are not safe unless everybody else is. And they keep repeating this rhetoric because that's what we want to see. Behind the scenes, they're doing exactly the opposite.
Right. Annelies, go ahead. I saw you had a comment.
Yes, no, I would like to set some facts straight. So India is the world's biggest producer of COVID-19 vaccines and the biggest distributor. They had an export stop when they faced their major second wave, but I think from next month or even this month onward, they will restart their export. India itself developed 3 vaccines. It's the Covishield, which was a tech transfer and an agreement with AstraZeneca in the UK. They produce it at very low price. And are the biggest producers in the world. And then they developed a de novo vaccine that is called Covaxin by Bharat. And just I think a week ago or two, they announced that they have developed the world's first DNA vaccine against Covishield.
Okay.
But Anne-Marie, allow me, Andrea. Anne-Marie, you realize that AstraZeneca that is produced in India is not recognized in the UK. You know, they've been very clear that if you're not vaccinated in the UK, then you're not able to go through the red list. So it doesn't really make sense. And I obviously applaud India's capability. However, there are a lot of African countries that are capable of doing the same. And I think we need to try and build the manufacturing capacity across the African countries, not only for COVID-19 vaccine, but for other drugs, not just that, really.
Right. Annelies, go ahead if you'd like to respond quickly, because I'd actually like to ask Anna and move on to the issue of now booster shots, as we had alluded to earlier. Because, Anna, we're seeing now in the Northern Hemisphere especially, winter is returning. Viruses tend to strengthen, and they tend to spread faster in the wintertime. So now the United States in particular and parts of Europe are looking to administer as many booster shots as possible. I mean, is there an excuse for that, though, given that they are going into a more dangerous season and that they do have a valid need to protect their vulnerable populations in particular?
So my understanding is that the science to back the need for boosters is just not there yet. Yes, of course, there are a portion of the population with, serious immune deficiency issues, and then there may well be justification for booster vaccinations for that portion of the population. But all evidence suggests at the moment that these vaccines are still working. They're still incredibly effective. And looking around at rich countries, you can see that. So I think this is a very, very controversial point, particularly so since rich countries use their buying power to purchase boosters, as has been said, and jump the queue. So we're seeing that many developing countries and the COVAX scheme that is there to serve primarily developing countries is constantly being pushed to the back of the queue because rich countries are paying much higher prices, and the few pharmaceutical corporations that are producing these vaccines are continuing to prioritize where they can make the biggest buck. And as you have said, we are seeing billionaires being created from these vaccines, yet billions of people are being pushed to the back of the queue. Health workers on the front line trying to save people have not been vaccinated, and yet we're talking about buying more doses to vaccinate healthy adults.
Right.
So yes, there is a need for a portion of the population if the science is there, but certainly not mass vaccination. We need to reallocate these doses that are in the hands of rich countries now, but most importantly, we need to redistribute the production of those vaccines.
Fair enough. Annelies, very quickly, I mean, are there actually newly formulated booster shots or just really a third shot of the very same that Americans in particular have already had? I know Americans personally that have gone for third, even fourth shots of Moderna or Pfizer just because they're not asked any questions when they walk into a pharmacy and want the extra protection.
So indeed, currently they are the same shot, so the same vaccine product a third time. And I totally agree with the previous speaker that the evidence is still strong that the two doses provide excellent long-term, persistent protection against severe disease. What we have seen, though, is an increase in milder breakthrough disease, and that drove the decision in the US. That said, it's very important to say the current pandemic is not driven by people who had two doses and where there's some waning. The current pandemic and the deaths in the US are driven by people who did not get vaccinated.
Okay, Annelies, I will let you have the last word. Unfortunately, we're out of time for this edition of The Newsmakers. I'd like to thank all three of my panelists so much for being with us, and to our viewers as well. We'll see you next time.